Pea whaingata le ala tau mawhai, pea o mai se mala tau mawhai, pea o ina tangi a te pae, i le langi ua te wai, ne le tau I tau mawhai, Awa e te whawai vai I me a whaingata te le mea e mawai ai ua puapuanga.
When we talk about Rheumatic Rescue, the name of our program, the question is what are we really rescuing kids from? And we're rescuing kids from being tired and being fatigued, being short of breath, their hearts failing, and eventually preventing even death. For young women who contract rheumatic heart disease, they're not able to have children. If they do, they're at a very, very high risk of dying during childbirth. So this disease has not only medical, but it also has great psychological, social, financial, many ramifications which are devastating to a country like Samoa.
Rheumatic fever is such a common disease in our children, and it has been quite difficult trying to get these kids to come in early, and Rheumatic Rescue has given us tremendous help in trying to screen these children, school children, so that we can identify them early and start treatment early to prevent, as you know, the complications such as rheumatic heart disease.
So the three components of Rheumatic Rescue include the health promotion element, the clinical, and the genetic screening. And it takes all three of these to create a comprehensive program.
For our screening protocol, we bring each of the children in, we collect their very basic information, we assign them a unique identifier number, and then we do what we call a rapid initial assessment, where we have an echocardiogram and we take a very quick look at the heart and basically make a determination if it's normal or abnormal. If it's normal, we reassure the children and their families, they go back to class. If it's abnormal, then we send them for a more comprehensive exam. As part of that, we get their height, we get their weight, we get more information from them, and we do an ultrasound looking at the valves in a much more aggressive manner. We're able to look to see the amount of regurgitation, which means leakage of the valves. We look to see if the valves are thickened, if they have limited mobility, and we look at both the aortic valve as well as the mitral valve, the ones that are two most commonly affected by rheumatic heart disease. Our purpose is to identify them at an early stage, get them to penicillin treatment, and prevent the downstream problems with failing hearts, failing valves, and death and surgery in these children.
For the educational component, we are able to use university students who are either enrolled in the nursing or community and public health programs. So these students are not yet certified clinicians, and so this is the perfect opportunity for them to see a great clinical program along with health promotion. And they enroll in a class and we prepare them a full semester prior to arriving in country. And they learn everything about rheumatic heart disease, program planning and development, the clinical aspects, and then they learn the actual educational features that we offer to the children and the parents. And as they do this, they not only learn them and memorize them, but they learn them in the Samoan language.
And it's amazing seeing the team who come in who don't know the language, and they talk to the kids in Samoa and actually present this educational part of the program in Samoan, it's such a good thing. It's just such a good feeling because they also learn our language and our culture.
We, in our own way, have redefined primary preventive care. We've gone right to the child. So we teach them, the children, in a way that the children can be taught to tell your parents or someone when you have a sore throat. I think one of the strengths of the Rheumatic Rescue Program is it includes, as team members, people in the National Health Services here in Samoa. And it's exciting to see them learn the screening techniques, to see them engage with the parents, to teach them. And not only does it give them the skills, but it helps their own people identify them as their source for assistance. And not necessarily the Rheumatic Rescue Team, but we're there as a support, and they see that as well.
We've been doing this for several years now, and we're starting to come back each year and screen children who were kind of borderline questionable in years past. And so by following these children year after year, we're able to identify those who are progressing and getting worse versus those who it's just a normal finding.
As we look long-term for Rheumatic Rescue, although we provide a good service to the people that we serve in Samoa, we've now evolved into a major research program.
And so the team had come in with experts for genetics.
So the rate of rheumatic heart disease in Samoa is elevated relative to other developing countries. And this is likely due to the unique genetic architecture of the Samoan people. DNA can be collected from any tissue from an individual. For our purposes, it's simple and cost-effective to collect DNA from saliva. We take that saliva back home, we treat it with a series of chemicals, and we extract pure DNA from that saliva. That DNA is then used for the downstream genetic work that we're doing to try to prevent and cure this disease.
This past year, we submitted 5 abstracts to the World Heart meetings.
And all 5 were accepted there, which gave us an opportunity then to network with other people who are researching this and offer them some of our information and feel like our program's on track.
We were able to communicate with other world leaders in this area, and we were really able to kind of get a first step into becoming a research force for identifying and treating these children on a worldwide platform, not just here in Samoa.
So we're working with a disease that affects children that we know can be prevented.
This is something that is more than just a typical humanitarian project.
We don't know where we could have gotten this, help to save our children, basically.
I believe this is something that we've been guided to do, and I believe that there's great things that are going to come of this greater than we'll ever know, and I'm just grateful to be part of it.
You know Rheumatic Rescue is a successful program because it's hard to differentiate between who is helping whom. And when you can't tell that difference, you know you have a successful program.